Welcome to Insights for Health with Dr. Rhee. Why insights? Because insights have to do with wisdom as opposed to knowledge. And wisdom is application of knowledge. Today I want to share with you ABCD of health or wellness. And let's look at the screen. There's ABCD of health. A stands for abdomen, B stands for blood pressure, C stands for cholesterol, and D stands for diabetes, indicating blood sugar. These are the four pillars of health that are very intimately connected. If you wanted to choose one out of the four to concentrate on, it would probably be abdominal girth or abdominal waist, because if you control your abdominal waist to being normal limits, then your blood pressure, cholesterol, and even your blood sugar may actually become much better controlled. So what are the normal parameters for these pillars of wellness? So let's look at the screen again. So abdominal girth or waist circumference for Caucasians and non-Asians. For females, it should be less than 35 inches around the waist. And for males, it should be less than 40 inches around the waist. For Asians, 31.5 inches for females or less, 35.5 inches or less for males. And it should be less than those values for you to have normal limits. Those of you who are used to metric system, especially for Asians, for females, it should be less than 80 centimeters, and for males, it should be less than 90 centimeters. B for blood pressure. Generally, hypertension is 140 over 90, right? But for wellness, your blood pressure should be less than 130 over 85. Let's go to the cholesterol. Cholesterol value. The total cholesterol value actually is a combination of triglyceride, HDL, and calculated LDL. In this case, we have two values that we look at for wellness. Triglyceride level should be less than 150, and HDL value should be greater than 50 for females and greater than 40 for males. And D for diabetes, indicating fasting sugar. It should be less than 100 after you've fasted for 12 hours. So as you can see, there are four pillars, but 5 lines, right? So 5 parameters that you need to look at. And these are basically pretty simple. If you have any 3 of the 5 parameters out of range, you're considered to have metabolic syndrome. So metabolic syndrome can lead to insulin resistance. And insulin resistance, how do you know if you have insulin resistance? Many times you don't feel any symptoms. But very first thing is belly fat. I brought some, a model of fat, and this is 1 pound of fat. So you can actually see how much 1 pound in the belly may look like. And I'm gonna also show you a cross section of this trunk model. And I want to show you the cross section here. And from outside in, this is skin. This is a subcutaneous fat underneath the skin. And this is muscle. And deeper than the muscle is visceral fat. Viscera in Latin means organ. So this is the organ fat. And so the most significant for your wellness is the organ fat. But recent research showed that subcutaneous fat also affects your wellness as well. So fat around your abdomen or belly fat is very critical for you to control. Because if you can control the belly fat, and if you have a very flat stomach, then you can kind of be pretty sure that you're actually, you're well on your way to becoming well. So remember this. And then this belly fat is generally caused by production of too much insulin Because insulin gets a bad name because, oh, I have insulin resistance. I don't want to have insulin being stimulated too much. But insulin is just a very, very essential hormone that helps us absorb nutrition, primarily glucose. And without glucose, we can't think, we can't function. And where is it produced? It's actually produced by the pancreas, and it's actually about like right here, and it's right below the stomach. Stomach sits about right here, and then here's the duodenum or duodenum. It's a small intestine. This is actually your gallbladder, and this right here is the pancreas, and this is spleen, where a lot of blood is stored. And so this little organ that's very very soft and long like this, sideways, that's lying underneath the stomach, produces insulin. And whenever there's food, whenever there's sugar in your blood, this organ actually is stimulated to produce insulin, so that insulin can knock on the cells to open the doors for sugar. But sometimes when you actually eat too much and when you have a belly fat, even though insulin knocks on the doors of the cells, your cells do not open the doors for sugar to come in. And so that's how you have sugar increasing in your blood. It's called hyperglycemia. And then if that continues to become a problem, then it can turn into diabetes, namely diabetes mellitus. Because diabetes actually means urine in Latin, and mellitus means honey. So diabetes mellitus means urine honey, like sweet urine basically. Disease that actually makes your urine sweet because your blood sugar spills into urine. So anyways, belly fat is where it all starts. So if you can control belly fat, you can say that you're well on your way to wellness. Second potential symptom that you may feel is fatigue. Even though you've slept, you still feel very tired, you're still yawning all day long, and you cannot function without some caffeine. Next one is bloating and swelling. If you wake up in the morning and if your fingers are swollen and your face feels swollen and your gut feels bloated, you may have insulin resistance. Metabolic syndrome that actually became insulin resistance. And then lastly, irritability. You may be very irritable throughout the whole day, even though you've actually don't have a good reason to become irritated. Every little thing can be irritating to you, and you may wonder, oh, maybe it's because I have insulin resistance. What is the best way to then reverse this, or is there a way to reverse this? You don't have diabetes yet, so there's no medication specifically. There are some medications that some doctors may prescribe, but is there a way to reverse this without taking medication? So on the next slide, I basically outline all the potential problems that insulin resistance can also lead to. Diabetes, as I mentioned. Next one is heart disease, leading to heart attack, stroke, and sometimes cancer. So the insulin resistance, metabolic syndrome, the belly fat is a very, very serious thing that impedes your wellness. So once again, I have a question for you. Which are the best way to improve insulin resistance? Specifically, I have a question. Which are two of the most practical and effective ways to improve insulin resistance? Number 1, sit-ups. Number 2, hula hoops. Number 3, intermittent fasting. Number 4, walking or hiking. Because we're talking about belly fat, right? So if you do a lot of sit-ups, if you do a lot of hula hoops, do you actually reduce belly fat? Research shows that intermittent fasting and walking or hiking are the most effective and practical ways to reduce your insulin resistance. So in the next video, I will talk to you about what intermittent fasting is and why exercising, specifically hiking or walking, is very, very effective in reversing the biggest hindrance to your wellness in this modern day society. So see you again next time.